In this video, you will see how mental health and services is implemented in a rural area, also how one can receive the treatment due to limited of funds or any barrier that is placed in their life. Also displayed in the video, there will be a scene where a guest speaker will come and discuss about mental health issues and the various mental health that is very common, especially in today's society, and letting the younger generation become more aware of the mental health and being able to treat those that have a mental health issues normal as possible. Also, the treatments that are available for them they may not be able to receive it or go to the place, but they are also able to still work with a social worker to provide those coping mechanisms to assist them at home, as well as having a loved one to support them. Mental health is a very sensitive topic in today's time due to a high rate of suicide and other death rates dealing with mental health. A lot of people are not aware of their mental health or do not receive the proper treatment at the proper age due to funds or many barriers or being in a small population, and privacy is a very, very big issue for them. So they are more comfortable with doing self-medication such as turning to drugs or alcohol or any other high-risk behaviors to numb those pain. Schizophrenia is also the main one that we are now seeing, especially in the younger generation, due to turning to some type of substance to cope with their problems, as well as depression. Depression and anxiety are are also diagnosed, and many people turn to self-medication where there are other medications for them that are prescribed to them by the doctor. They may not have the funds to purchase those prescribed medicines, so they turn to drugs or alcohol or try to find other coping skills to numb the mental health issues and to drown everything they have going on. So I hope you enjoyed the video and also learn a lot. Good morning, class.
Good morning, Mrs. Evans.
Today we have a guest speaker to come in to talk to you about mental health and to let you know what type of services social workers can provide. Give her all your attention.
Yes, ma'am.
Good morning, everybody.
Good morning, Mrs. Sims.
How are we doing today?
Good.
Are we excited?
Yes.
Okay, so today I want to talk about mental health and how social workers have to step in and help those that are in need due to funds or they do not have a place to go to. So, do anybody have any questions so far? Yes, sir.
What is mental health?
Mental health is a person's condition about their psychosocial and emotional well-being. Do you have any more questions so far? Yes.
Are there any programs to help them?
Yes, there are actually a lot of programs to help them, but I'm only going to name a few just because of the time frame that we have. And the first program is the Clifford Beard Society, which helps leaders go to those clients that need help, as well as Life on Campus, since a lot of young adults face mental issues such as depression, anxiety, PTSD, schizophrenia, and they kind of turn to a substance to help them. So they have Life on Campus to go to those students, to talk to them, and to kind of help them along the way to be successful in school. Any more questions? Yes.
Are there any policies to help them?
Yes, there are actually a lot of policies, but the main one is the construction of mental retardation and facilities and community mental health centers. So this create buildings for them to go to so they could go for their treatment or to talk to a social worker, to receive money, or to allow them to have other type of ways to cope with their mental illness. So do we kind of have an understanding of what mental health and the services there are so far? Do you have any other questions or comments about it? Yes.
Thank you so much, Ms. Sims. Now I know all about mental health policies and programs and how social workers can benefit them.
Yes, so I'm glad y'all enjoyed.
Thank you.
Thank you for watching this video. I hope you learned some valuable information from it about the mental health and services, especially in the rural area. Substance abuse is the main aspect of mental health issues due to if someone is placed in a rural area, the only thing they might know is substance abuse and the different drugs and alcohol that is available to them. So they will turn to substance abuse or alcohol to have fun, and this was also determined mental health issues such as depression and anxiety. Thank you.